Some of the really common challenges that we hear from AYAs are they feel lost, they feel alone or isolated, disconnected from their peers, torn away from their normal routines and environments and their safe spaces. They feel really torn between dependence on parents and wanting support and wanting independence and craving the ability to be their own person. They feel really out of place when they're sitting in a room with teddy bears and stuffed animals. Sometimes they want a teddy bear. They just want you to talk to them and not to talk to their parents with them on the side. Sometimes they want colorful walls and paint on the walls and comfortable spaces and to feel like a kid, because when you go through a cancer diagnosis and treatment at 18 or 19 or 20, oftentimes you want your mom or dad to be the one taking the lead.
My name is William Kadash. I'm 31 years old. I was diagnosed with stage 3B testicular cancer in late 2016. I was 24 at the time.
My name is Fiona Gutierrez-Dewar. I'm currently 28 years old. When I was diagnosed with non-Hodgkin's lymphoma, I was 22.
My name is Ranjit. I'm 32 years old. I was a patient when I was 16 years old. And I was originally diagnosed with osteosarcoma and received treatment for about 1 year.
My name's Laura Farhat. I am 33 years old, and I was diagnosed when I was 14. I'm actually a current patient. My diagnosis was stomach cancer.
AYA, or adolescent young adults, are patients that are diagnosed with cancer between the ages of 15 to 39. For adolescent young adults especially, this is a difficult time to have a diagnosis of cancer. And I think, shock is one word, but I think that, doesn't explain enough of the feelings they must go through at that time.
Having a cancer diagnosis at, a very young adult age, it's very rattling, I think, at a time when you're just trying to build your life and define your identity. And, whether you're in college or in high school or just finishing, you're still sort of like thinking and trying to plan for life and what you want to accomplish. I was like, I've never even been in love. I don't know what I want to do in this world. And now I'm facing my own mortality.
The experience at the hospital can be quite lonely, faced with this being forced to grow up in a way where your childhood feels less like your childhood. So I think in the hospital, that's when I maybe started to experience feelings of otherness or difference, especially from my peers.
I remember the day I was diagnosed, we were asking the questions and we kind of went through the list of what treatment's going to look like, right? And they mentioned the mortality rate and that I would be getting pretty heavy doses of chemotherapy for 10 months and multiple surgeries. And that didn't really bother me nearly as much as when they told me that I wasn't going to play football anymore and I wasn't going to be able to run potentially. I kind of shut down at that point to hear, you might never run again, much less, get back to the sports at all. Was really hard to process.
These folks are really unique because, truthfully, in a lot of different settings, when they're diagnosed with cancer, they could be treated in a pediatric system or in an adult system. And we hear from folks that they don't really fit no matter what.
I was probably about half the age of a lot of people, sometimes, they were about 3 times my age. Looking back on it now, I would have liked somebody there either relatively around my age or even younger, talk about what's going on in life and shared experiences, shared music, shared movies, stuff like that.
So much of it is kind of designed for, young kids, and you're in the hospital and you're kind of trying to pass the time to get through treatment, and there wasn't too much, for a young adult to do.
So the goal and the mission of the Stanford AYA Cancer Program is to try to fill the needs of this unique population so that folks don't feel so lost in between, and so that they feel that they have a place to come to where people really get it and understand that the needs of teenagers and young people in their teens and 20s are so different from younger kids that we treat and from older adults who go through cancer.
I tell my patients all the time, I'm not going to tell you what to do. What I want to do is give you the information, whether it be about fertility, psychosocial, the AYA community, and other resources that are out there so that you can make the best decision that you can make.
The types of programs that SAYAC provides include fertility preservation or family planning. In other cases, we're thinking about where someone is in their school or their work and how to support them both socially and functionally. So the AYA program works really closely with our social workers as well.
So we took full advantage of the fertility options that they provide and resources that they provide at Stanford, because with my testicular cancer diagnosis, severed my ability to conceive naturally. So with the resources that I got from the SAYC, I was able to get an appointment with a fertility doctor at Stanford, and we went through the IVF process with Stanford, and resulted in 3 viable embryos, and one of those is now my daughter. So Charlotte is her name. She is 4 months, and she is now getting into that smiley stage and laughing and talking, which is just the most adorable thing ever. My wife and I are just over the moon.
We have a growing psychosocial oncology program in the Bass Center, developing a robust psychosocial oncology program. And so the SAYAC program works closely to think about need for, in some cases, counseling or one-on-one mental health support.
Peer-to-peer support is actually really important. I think if you have mentoring programs where someone who is currently in the midst of a very recent diagnosis or a very difficult one, to have someone that they can talk to and basically anticipate a future, I really think there's a strong degree of hopelessness. So if you can actually have someone on your side who's rooting for you, who can give you advice, who can tell you how to navigate the healthcare system, that will go a long way.
The challenge is seeing these patients not as an adult and not as a pediatric patient, but as an AYA patient. Really trying to build programs that can focus on let's create an adolescent young adult community, but also what about a unit where only adolescent and young adults might be treated? How about even a waiting room in a clinic where adolescents and young adults could be there together while they're waiting? Infusion room in the cancer center that can be dedicated to adolescent and young adults, so that when you see somebody get an infusion next to you, they're your age, or at least somewhere close to your age.
Young people, so adolescents, young adults, AYAs, often feel invisible in our healthcare system because their needs are distinctly trapped between those of a younger child and those of an older adult. In our society, young people sometimes feel invisible as well. And I think what I would like for people to do is honestly just reflect back on your own growing up, your own time as a teenager, as a young adult, and superimpose on that any type of adversity that you faced, and know that the way that we can help their needs be less invisible is through support to grow and develop programs that are specifically developed with them and for them.